Hi, my name is Mo Belal. I'm a consultant urological surgeon in Birmingham, and I suffered spinal cord injury almost 4 years ago. I think I always remember this young patient I had with a spinal cord injury, and what I really learned was, he had that positivity, and no matter what happened, he always maintained that positivity. And what he showed was that you can't do anything about the past, but what you can do is about the future. And I think if you keep a positive mindset, it makes a big difference. And so he suffered lots of problems with infections from his urinary systems and self-catheterizing. He ended up having a major surgery such as an augmentation cystoplasty. But throughout the whole process, he maintained that positivity. And I think that's what I learned about the essential part of the human spirit, and the courage that we have within ourselves when we go through difficult times. I think there's a huge amount of scope for that. I think you have to embrace technology, you have to embrace AI. I think that AI is going to be a game changer, not just in rehabilitation medicine, in all aspects of our lives. And I think what it can do is an adjunct to help make it easier. And so what you can have is, one of the problems we have in healthcare is there's not enough healthcare practitioners, and actually AI will almost allow an assistant to help them optimize, and you can then individualize individual rehab programs using AI. In terms of technology, I think that the technology has a huge future in terms of overcoming physical disabilities, and also in terms of bladder bowel management. And so when you look at some of the new irrigation systems, they're very much electronic. And so I envisage, it's a partnership that's really important, and I think that bodes well for the future. I think it's very important to have a very broad experience of SCI care, and I think it's really important that as part of that you work in lots of different disciplines. But also, I think you've always got to be thinking about how to find bespoke solutions for your patients and being brave. I think there's lots of evidence in spinal cord injury, and quite often it's not used in clinical practice. And so, just because your predecessor said something doesn't mean that's the way it's going to be. And so what I would say to someone coming on, it's actually an amazing field. I think you can have a huge impact on individuals, and neuro rehab per se can make a massive difference to society. I think the key thing is also to realize it's a ultra marathon, and to take your time, not put too much pressure on yourself as you go through that journey, a journey of lifelong learning. I think education is crucially important, and I think the gaps are not people who provide SCI care. I think that the education there is good. It's actually other healthcare professionals, and so what tends to happen is the deficiencies tend to be with the generic healthcare, who don't really understand the complexities of spinal cord injury. And so I think education per se within healthcare professionals specializing in spinal cord injury is excellent. I think what we need is further patient empowerment. We need further educational for not just the patients but the families too as well. But I think there should be a greater emphasis for general healthcare practitioners about the difficulties and challenges of spinal cord injury patients. I think it's amazing because you meet a lot of different healthcare professionals on an international level and different experts, and you realize how things different are in different environments. And so there's always things to take back, and certainly I've already learned several things in terms of not just urology, in terms of obesity, liver management. And so I think ISCOS is a fantastic organization because it brings truly a worldwide experts from either it's America, Europe, Asia, Africa, and that's been quite nice to see, and also a network.